It's Dr. Bouvier with Dr. and You, and you've come to the video to learn a little bit more about blood pressure and the little idiosyncrasies and problems that can occur from that. The reason we're worried about hypertension is pretty simple because, number one, people die of stroke and heart attack, and that's one of the major causes, along with high cholesterol and high blood sugar. In fact, the only three causes of stroke and heart attack is blood pressure out of control, cholesterol out of control, and blood sugar out of control. Unfortunately, those are aging diseases, and you eventually will have that. So, in my friend's case here, he's kept up with his book really good. He's got the general information, medications. In fact, you were just seeing your cardiologist up north, and he commented how much he really appreciated that he wished all his patients would have this book. But he's pretty well documented with the blood pressure medications we've done on him. And his blood pressure would go up in the 200 plus range, and he'd have a headache, so that would be in the malignant side of hypertension. So we did call it malignant hypertension at one time, essential hypertension. We've done an echocardiogram, stress test, 24-hour urine for protein, but we also do VMA, vanillin mandelic acid, and metanephrines. And we check for carcinoid and pheochromocytoma, and his was elevated. So we're actually working him up for a pheo. But that's a difficult thing. In the meantime, we've tried numerous medications. We're using Bistolic on him because Bistolic is one of the only beta blockers that do not make insulin resistance worse. It's almost impossible to get a hemoglobin A1C of 7 or less when somebody's taking 100 milligrams of metoprolol or atenolol or Inderal. Corig is the only other beta blocker that you can use that won't make insulin resistance worse, but then again, it's not as clean a beta blocker as Bistolic. Bistolic's probably the #1 drug up to 10 milligrams a day to have just the beta-1 effect, but it is a vasodilator. He's also on lisinopril, amlodipine, and he's taking Catapress if his blood pressure goes above 160. We tried Catapress patch. He had all the side effects you can think of. Remember, Catapress is a centrally acting alpha drug that dilates from the brain, and he just got doled affect, kept going for a week and a half, and he just stopped taking it. Because of the question of kidney issues and so hard to diagnose renal artery stenosis, it's probably one of the most difficult things in the area. It's wrought with false positive and false negative X-ray and even angiogram, MRA results even. So the renal artery stenosis is difficult to document. So we're working him up for all of those things. His blood pressure is still ranging in the 150 to 170 range at times, but in general, we're heading for it. A lot of the kidney doctors like to use the Catapress, we do too, and also spironolactone. So today we added spironolactone, 25 milligrams a day, to his blood pressure medication to see if we can get it down to that sweet spot. The sweet spot for normal blood pressure, if you can get it there, is 115 over 75. Why do I say 115 over 75? We know statistically that even at 135 over 85, you have a 2 times the risk of stroke and heart attack, statistically when you take the population into account. At 155 over 95, you get a 4 times the risk of stroke and heart attack, and the risk goes up and up. So in order to get the normal risk of blood pressure, that blood pressure needs to be the 115 over 75. In general, I like to tell my patients that 110 to 130 over 60 to 80 is kind of our sweet spot. He has diabetes and a couple other things, so and the cholesterol. So we've used all those medications that don't tend to raise the lipid profile or worsen insulin resistance. So the bottom line here is a couple fold. Number one, blood pressure kills people, along with cholesterol and diabetes. The #1 killer because stroke and heart attack is the #1 killer in the United States. Normal blood pressure is 115 over 75. It takes 2.8 medications for people with stage 1 hypertension to get it under control. That's the average. 2.8 medications. That's people with blood pressure 160 over 90 or below. That's stage 1. Anything 160 over 90 or above is stage 2. So for stage 1 disease, the average is 2.8 medications. I like to tell my patients that right away because they say, oh, I got to take medication, it's going to get under control. No, the average in the country is you have to use 2.8 medications to get it back to normal. Second thing I want you to understand is what is normal. Normal blood pressure is the 115/75. Understand the risk. Even at 135/85, you get a 2 times the risk of stroke and heart attack. At 155/95, you get a 4 times the risk of stroke and heart attack and upwards. If you want those stats or some slides to go along with that, just email me, robert@robertbouvier.com, and I'll send those to you. Great educational tools for you to show to your patients. It really drives home, you know what goes on. The third thing is I like to look, every one of my hypertensive patients, I like to look for those oddball issues. It's not just essential hypertension we're working with. With him, his heart's a little bit dilated from the echocardiogram. We found pulmonary hypertension on the right side of his heart. When we did the echo, we did the 24-hour urine. We found we're working him up for a pheochromocytoma, and all these things, are a potential when you're working with high blood pressure. And I encourage you to do that 24-hour urine and the echocardiogram. There's a lot of other pearls coming for hypertension and the control of hypertension and what we can do about that. But do your patients a favor and really understand this process. It's not as simple as you think. Again, this is Dr. Robert Bouvier. We're talking about essential and malignant hypertension pearls. Have a great day.